yeah, but I just got involved by volunteering to be on this disaster relief team and then just jumping in and being willing to try. It's not easy. It's like 12-hour days often, and you sleep somewhere you wouldn't normally want to sleep necessarily, but
Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2BE podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
Welcome back to another week of the RD2BE podcast. I'm your registered dietitian host, Carl Barnes. This is our weekly podcast where we sit down with a different awesome, distinguished registered dietitian each week to showcase the diversity of opportunity in the profession and essentially dismantle the notion that there is a traditional career path in the dietetics world. Very honored to be sitting down with Laurie Sauerwein today. She's an international public health nutritionist. Really excited to learn about all that you've done and what you're doing currently. So thanks so much. I'm going to pass it off to Jenna to get started here.
And I'm Jenna, your RD2BE. And so Laurie, first, thank you so much for being here. Now, could you give us a little not background, but your current role that you do as a dietitian?
yeah, you're welcome. Thanks for inviting me. Well, currently I'm retired from most paid positions in the dietetics world, and I do international projects as they come up and as they're offered to me. International mission trips of teaching nutrition to groups from community health workers to physicians in hospitals, mission hospitals around the world. And I'm also part of some disaster assistance relief teams, international, which they call you up and say, can you go in 2 days to Ethiopia was my most recent one. And then I was also in Texas in February with Afghan refugee resettlement. So those are the things I'm most involved in currently, and it's not full-time by any means, but it's as needed.
Yeah, and it's awesome to hear all the traveling that you do with what you currently do. So can we start very much at the beginning, where what made you initially decide to become a registered dietitian?
Sure, you bet. So when I was in college, I initially thought I would be a physician. And then I took a couple first aid classes and I volunteered in an emergency room, and I realized medicine was not for me. I fainted dead away in one advanced first aid class, and I felt sick and had to go lay down in the emergency room one time. So I decided I was probably not. And then I thought about nursing. Then I thought, no, if I'm going to do this, I don't want to be cleaning up messes and that kind of thing. So I took a nutrition class as part of my nursing course. And I said, that's the thing for me. The patients are going to be all cleaned up. They're going to be in bed and they're going to be interested in talking. And so that's what I want to do. And so that's how it came about.
Awesome. And I can confidently say that when it comes to other parts of the healthcare field, dietetics definitely gravitated towards me for that exact reason of, yes, depending on what field you go into for dietetics, it can get a little messy, but you also have all the super nice and clean and comfy situations that you're able to choose from. And so that's awesome. And so prior to what you currently do on like the international global disaster relief setting, and with the Global Member Interest Group, you also worked in WIC and in outpatient. And so could you describe what you specifically did in those roles as a dietitian?
Right. And initially I did start out in clinical. I worked at Oregon Health Science University way back when as a clinical dietitian, and then also at the VA hospital in Portland, Oregon. And that was really foundational for my career, I would say, because I did some really good application of the science behind nutrition and dietetics. And so that was a good start for me. And then when our children came along, we have 4 children, and just became too much for me to do clinical full-time or even part-time and keep up with all the things I felt I needed to do. So I took a job with WIC, and it was all community nutrition, and I really enjoyed that. So I did that. I was with the WIC program for about 25 years, and then I went to outpatient clinical. And during the WIC period, I also did some outpatient clinical as the clinic had need. But then I became an embedded dietitian with a clinical team. This is kind of a new concept, and it's not done very many places, but it's super effective, I think. And you work right in the clinic with the physicians and a psychologist on a kind of a team. And so when the physician is finished in a room with a patient, they ask, and they feel that a dietitian would be really helpful to this patient, they'll ask them, is it okay if I send the dietitian in? Or sometimes I just go in and introduce myself and say, I'm the dietitian, and I can be of help to you. Are you interested? And then you right there sit down with them for 10 to 15 minutes. And then if the next time they come back, you have 10 or 15 minutes more. Or
Awesome.
sometimes you can have them, because you've introduced yourself, they know who you are and that you're not going to shake your finger at them. You're going to help them.
Awesome. Yeah.
Yeah, and they're willing to come back.
Gotcha. And so with that kind of, I guess, interdisciplinary group that you were in, do you see that as an emerging thing that more clinical and hospital settings are going to have, or do you think that that's a sort of thing that if an aspiring registered dietitian wanted to pursue, they'd kind of have to pick and choose what site would have that?
Yes, that's absolutely true. I think the clinic that I worked for was a federally qualified healthcare clinic, and they get grants, and they decided to spend their grants on having dietitians in the clinic embedded without having any way to pay for this, really, because you can't bill for these 10 to 15-minute appointments, unfortunately, with a dietitian. But they decided that's what they were going to spend their grant on. And so once it happened in one or two of their clinics, then the rest of the clinic system said, hey, we want this too. So it was saving the doctors so much time, and was far more effective than having the doctors try to do the quick dietetic, nutrition instruction.
Yeah.
So yeah, but I do say you would have to look for a job like that. It's becoming more popular, and because of these few clinics around the country that are doing it, are teaching others how to do it. But it requires the funds.
Yeah, and what's really exciting is the patient gets more like hands-on nutrition experience from that, because like what you said, nursing, it's absolutely nothing to discredit the hard work that nursing and doctors and what they go into. But when it comes to a dietitian talking to you about nutrition related stuff, that's the most up-to-date, most informed professional that you could talk to about it, versus a nurse or a doctor who had 2, maybe 3 classes on nutrition, who knows how long ago, in trying to educate a patient on that. And so in your clinical and WIC roles, was there anything challenging that you particularly experienced that stuck with you throughout the rest of your career? And did you learn anything from that challenging experience, if you had one?
Well, I would say there are a number of challenging patients that came along. And the most challenging thing is that everyone is different. And I think the social determinants of health is a good start toward finding more of the underlying problems rather than just telling people what to do. So I would say many of the patients I've seen were challenging. They had challenging backgrounds. They had challenging reasons for why they would be obese or eating poorly, or had orthorexia, anorexia. There's always something underlying all these things, it seems like. So I think more it was just a learning experience for me. Okay, you have a patient that has this background. How are they coping with it? And what role does food play in that? And then how can you help them to understand that background for themselves and lean towards healthy eating. So I would say not any one given patient. There's been a few really interesting ones over time, but not any more challenging than anyone else, just a regular diabetic that has no help at home and no encouragement from anyone else except you and their physician.
Gotcha. And when it came to like interacting with those patients that had those very diverse backgrounds and different social upbringings, how did you go about kind of working around and problem solving with those different patients?
Well, first of all, I think it's allowing them to see that you're sympathetic or empathetic with their circumstances, and then just say how, first of all, you have to make sure that they're motivated. You don't want to try to motivate someone because it's pretty difficult. If they're not motivated by the fact that their physician says you should be doing this and you might die if you don't, then there's not a lot a dietitian can do. You can go talk to them and say, how can we help you? Or do you have a family member that's willing to come with you, and maybe that will help. But that's the number one thing. And then after that, you ask a lot of questions about what their home situation is like, and if they feel like they're want to try. My whole thought is to give them one or two main things that they can do that will really make a difference with their health. Don't try to solve every problem you have. Just one or two goals, and then if they can accomplish those, you can maybe move on to something else. But you have to start small and easy, because it's always difficult to break habits, and make new habits.
Yeah, for sure. And like baby steps with anything, that's kind of the name of the game, especially if it's something as intimidating and as daunting as like improving your health. Like
Right.
it's better to just isolate one or two things, work towards that. Because then also motivation, that's a really great thing. Because if you just start with something that they're like, oh, okay, I can do that, but then they see the result of them doing it, they're like, oh, I want it even more. And so it's a great just way to build up that motivation that they might have not had previously. And so with those roles that you did, was there anything in those experiences that influenced your passion for global health and nutrition?
Well, the federally qualified health center I worked for was, well, I worked for several of them, and they were mostly Spanish speaking recent immigrants to the US. My interest in global nutrition and global health came long before that. My husband's a physician, and he's very interested in global health too. In fact, when he finished his residency or his medical school, we spent 3 months in the DRC way back when, just because we really felt called to that. We're very flexible and like to camp, and we're really outdoors people, and things are easy for us when we travel. It doesn't bother us to be flexible and go to the bathroom behind a tree or whatever, that kind of thing that you need if you're going to travel a lot. And so we've just been really blessed with finances and things so that we're able to go and do volunteer work. And so we started out that way. I would say he also worked in a federally qualified health center. And so we worked with a lot of these recent immigrants. And so that just makes you even more cognizant of the differences in culture and the needs of people that come from other cultures. So I would say it didn't spark my interest, but it contributed to.
And definitely like that, it gave you that extra edge towards that exposure and like another outlet to kind of see different cultures. And were there any major, I mean, of course, with having those immigrants and having the communication between them, were there any big barriers that you had to overcome with serving that population? And is there any advice for RD2Bs you could give about communicating to different cultures and different populations like that?
Yeah, I would say that's a good question. Number one was that you have to recognize that there's going to be a cultural difference. That's the number one thing. That your culture is far different, and even just in our own US, there's many different cultures beside cultures within even say the Caucasian population. There are differences in culture based on your family background and that kind of thing. But one thing that I always made sure to do was ask the women who worked with me, who were second generation immigrants and spoke Spanish. And I speak enough nutritional Spanish to teach nutrition, but that's about it. And so, but I would always ask them, okay, this is something that came up. How would your family deal with this? Or how would you deal with this? Because most of them were Spanish speaking, bilingual from Mexico, but they had been in the country a couple, generations. And so now they were working for the clinics. So that's the best thing, I think, is always to be curious and ask questions. Don't assume that you know how someone is going to react to something or how they do things in their own home. What are the cultural nuances that you should know about in order to deal with the population? I'm sure even asking these questions, you're not going to know for sure, since I didn't come from that background, but it's always helpful to ask others who are from that background.
Yeah, and like using the resources at your disposal. And I think it's just not feeling like all of it's on you to try and solve a situation that's outside of something that you don't know. And like, it's okay if you don't know, but it's even better to ask questions for the people who do know. And so another organization that you are involved with is the Academy of Nutrition and Dietetics Global Member Interest Group. And
Right.
so can you kind of describe the process as to what got you involved with that interest group?
Yes. Okay. So I was kind of in on the foundation of this group. There were two women who came up with the idea, and they recruited me and several others, and we said yes. There's really nothing in the academy that appeals to people like ourselves. There's the international affiliate, dietetic affiliate, but most of those people are working in countries such as Israel or Germany, places that are pretty high already on the nutrition status level. So, and they just don't have a state. They don't have a state that they're affiliated with. Therefore, they affiliate with the International Dietetic. But for people working in humanitarian nutrition, there really wasn't anything much in the academy, and there's not much addressed. And so we felt, all of us were volunteers, nutrition volunteers internationally, and we decided that there really needed to be something. Charlotte Block, whom you interviewed, was in on the ground floor too. And so we just put together this MIG and filled out all the paperwork required, and then got started. We have a website, and it started out basic, and now it's pretty robust. So it's been about five years, I think, now since we started it.
Awesome. And so what exactly does the member interest group offer for both registered dietitians and RD2Bs?
Well, we have this great website, and you can go on the website, and until you're a member, you can't see everything that's offered, but you can at least see the basics of what's there. And we offer continuing education. We have webinars 4 times a year. That's our goal. Have Charlotte Block's been a speaker. I've been a speaker. And then we try to get people from outside organizations to come in and tell us about their, like we're hoping to have someone from Save the Children come and talk to us. We've had people who are from, or who have started a nonprofit that's specific to international nutrition. So just have some great resources that way. And then we have a resource library where one of our members has put together a whole library of resources for teaching and for just information about malnutrition. And then there's all kinds of links to organizations like parts of the UN and USAID that offer many other resources on nutrition. So that's a real benefit, because you can, if you're going to go to a certain country, you can go on there and look and see what we have about their culture or about teaching in that culture. So that's just excellent. And then we also have a discussion board, so you can, if you have a question, or if some of us who follow international nutrition websites or like listservs. We see, okay, there's a job posted that looks like someone who doesn't have a lot of experience overseas could possibly do. And so we post that on our discussion board, and it goes out to all our members, including our student members. And those who are just graduated might say, well, how am I ever going to get into international nutrition with no experience? Well, some of these jobs that we post will start you out that way.
Yeah,
So,
that's awesome.
yeah. And just there's other things too. We have a whole list of dietetic internships on there that offer an international component to them.
Yeah, that's so cool and a really great resource for students. And so because you said that you were pretty much at the beginning of the creation of Global Member Interest Group. And so was there anything with that process of building it up or even your own experience of using it? Has it benefited your career as a dietitian in any like substantive way that you could describe, or how it's helped your role as a dietitian for serving certain populations?
Mm-hmm. Well, I'd say having contact with some of these people like Charlotte Block is just really encouraging. And just the putting together of the whole thing to see how it started up and how you can go about getting this, and how willing people are to join in when you have something that's substantive that people believe in and really need and want, then you can really gather a good group of people. So just the process of getting the Global MIG going has been really interesting to me and informative. And I would say because I'm already in the international world, I probably haven't learned too much from the MIG itself, but I can get my CPE that way. And it's just, it's opened up some more links within the international nutrition world for me to, have as a resource, a backup.
Great. And so for RD2Bs, is there any way that they can use the member interest group as an opportunity, or is there a way that they can help contribute towards the interest group other than using it as a resource?
Yes, oh sure. We've had a number of students be officers actually. Our last two secretaries were actually students. They were graduate students, and then another one, the treasurer, currently is a graduate student. So we've had a lot of students involved. Anybody's welcome to be on the leadership committee, and that's really interesting because you get to be in all the leadership meetings once a month and meet all these people who have worked really hard on getting it started, but are very involved in international nutrition. So, and we have committees, education committee, I'm on that. And we have a resource committee, and we have I think Karen Mills might be on I'm trying to think of what she might be on. Anyway, she's on one of the committees for outreach, I think, to try to reach out to organizations that might want to be affiliated with us, or a networking partner. So there are many things that a student can do to get involved. Yeah, for sure.
Awesome. And so would you say that if they were interested in getting involved in the MIG, would you say going to the official website, would that be the best starting point to kind of knowing who to contact, the information of everything?
Yes, definitely. Yeah, if you go on there, you'll see people's names, and I mean, they're welcome to contact me, and I'm sure Charlotte or Karen would say the same, and we can get them. And if you're a member of the Academy as a student member, then you can join. I think might be $5 or $15. It's not much to join the Global MIG. And then you'll be on the roster and get any information. We send out we have Instagram posts, and we send out newsletters and e-blasts, that kind of thing.
Awesome. And so you previously said that you did projects, whether it was through the Global Member Interest Group or disaster relief, all that jazz. And so is there one project that you've done that you are the most proud of?
I would say in 2017, I went to Haiti to do a World Food Program contract through the organization Samaritan's Purse that we work with, my husband and I, the International Disaster Relief Program. And I was running a World Food Program contract there. And that was for women and children. It was like a WIC program, only World Food Program was providing the food. And that was very satisfying because people were really needing the food after the hurricane. And then in Ethiopia, I was in Ethiopia in September, August and September, running a World Food Program contract, feeding people who were displaced, mostly internally displaced people, or just people who were in the conflict zone up there in northern Ethiopia, Tigray. And there was no other way they were going to get food unless we were up there. It was mostly Tigrayan staff, but I was the manager for Samaritan's Purse of the contract for a short time, 6 weeks. So that I was really happy to be there, because if we hadn't been there, it was a very insecure situation. But if we hadn't been there, they wouldn't have food. So.
And so how did you get involved with those projects? Like, how were you selected to be the one to go to Haiti and go to those places?
Well, because I'm a nutritionist, a dietitian, they assume that I know about food. And when I first ran the contract in Haiti, I really didn't know about running a contract, but I learned that's part of it, is being very flexible and willing to just jump in and say, okay, I don't know really how to do this, but I'm going to do it and figure it out. And there's always staff on the ground once you get there, Haitian staff or Ethiopian staff that have been doing this, because you're probably the second or third manager. I mean, you could be the first one, but generally for me, I've been the second manager or the third manager that's been there. And so the program is already running, and you just have to learn from your local staff.
Awesome.
And yeah, I would say that there's some things you need to know, like how to use Excel spreadsheet, which is downfall for me because I'm not very good at it. But most young people nowadays know it well. So that's one thing. And then you have to be willing to be a boss and stand your ground and say, no, this is the way it has to be done. So yeah, but I just got involved by volunteering to be on this disaster relief team, and then just jumping in and being willing to try. It's not easy. It's like 12-hour days often, and you sleep somewhere you wouldn't normally want to sleep necessarily, but eat food that you probably haven't eaten and that kind of thing.
Yeah, but it sounds like a very fulfilling experience and like super great. And so along with the other projects that you've done, I mean, COVID has definitely impacted a lot of traveling, a lot of within the past 2 years, impacting going to other countries and possibly doing these disaster reliefs. So has the pandemic impacted any projects that you had underway, or have you seen any global nutrition projects kind of axed out because of the pandemic?
Yes, definitely. I would say it's difficult to do any volunteer work that was already on the books and not urgent or emergent. Like this going to Ethiopia, that was during the pandemic, but we're just required to be vaccinated, and then you have to test yourself every time you get on, go on the plane. And when you get to the country, they required testing, but because it was humanitarian, they allowed it to happen. But I was also involved in going to go teach in Bolivia, and we got that one was shut down. It was just teaching community health workers for a couple of weeks, and that one got shut down because of COVID. We weren't allowed to do it. So some things definitely are impacted.
And so how did you adapt and overcome to those changes and kind of wrench thrown into projects that you had underway? Because we do have a common theme of kind of the flexibility that you had adapting to certain situations. And so specifically with the pandemic and on the global scale, how exactly did you adapt when it hit you in that way?
Well, but with the Bolivia thing, it just got canceled, and it's still on hold, hoping maybe next year we can do it. The Academy doesn't allow, that's the other thing with the Global Member Interest Group, is we do have some mini grants so that people can apply for them if they're say they want to go to Bolivia and teach nutrition, but they can't afford to pay for the whole thing themselves. Often, almost always, these volunteer mission projects you're required to pay your way. But we do have mini grants that we give out, a couple of them a year through the Global MIG to help people go on these trips if they want to apply. So, but anyway, so the academy is not allowing us to give money toward international travel at this point. So those have been canceled, but the mini grants we're still trying to give out so people can do some projects that they can do from the US online. And we try to notify people of those too in the Global Make group. We let you know, okay, here's something you could do from the US that will benefit international. And as far as my Ethiopia trip or the international disaster relief, that goes on. You just have to get permission and take the test and get your shots.
Mm-hmm. Gotcha. And
emergent, so
mm-hmm.
that has to be done. They figure out a way to do it.
Gotcha. Yeah. And so with kind of honing in back onto flexibility, you've had to do it a lot, whether with the pandemic, without the pandemic, traveling to these different countries, having to adapt to completely new situations. Do you have any advice or things that you learned through those experiences that could be applied to RD2BEs, whether it's something as simple as being nervous for their first day at their new college or going into their dietetic internship, just any realm of a dietetic student that would involve flexibility? Do you have any advice for them given your super unique and rather hardcore experiences on flexibility?
Yeah, well, I would say number one is I didn't start out going to a conflict zone like Northern Ethiopia. I started out going on some volunteer trips where you have to be somewhat flexible, but you still, you don't have to have security on every truck that you ride on and that kind of thing. You don't have to have the UN with their guns right there watching things. So you start out slow by going somewhere, say South America, Central America, South America, where it's pretty stable, and you just can go and have a bed to sleep in and probably have a bathroom and that kind of thing. It depends. Some people can just jump in and go, sleep in a tent wherever they're going to go and not care if the outhouse is the squatty potty or whatever, but there's lots of mosquitoes. But you have to know yourself. What's my limit on what I'm willing to be flexible? How flexible am I really? And sometimes you don't even know until you go try to do these things. So that's what I would say is start out doing what you did, Jenna, basically, where you said, okay, well, I'm not sure I can do this, but I'm going to jump in and do it. And now you enjoy it and you find out you can do it. And that's part of it, is building your confidence. So some people have to start real slow and basic, and other people are just like, well, I can do this. I can go out in the woods and backpack for days, so I probably can go sleep in a tent overseas.
Yeah.
What the limits are, but most people can work up to it.
Yeah, and that's great. And kind of knowing your limits, that's a really good thing to kind of take into account, where it's always great to jump into things. That's the best way. I mean, just like what you said, me jumping into being a podcast host, I never thought that I could do it until I did it. But then, you kind of have to figure out what specific situations you're able to reflect on the past limits that you took and then seeing if it applies to that situation. Now, but then of course you do have those situations where it's like, should I jump into this little pool of alligators? Well, knowing my limits, that's probably not the best thing to do. But I think that is, when it comes to the safe realm of dietetics where no one's going to hurt you, I think that's a really good thing to take into account. And what you mentioned, where it kind of said starting small, especially for dietetic students interested in global nutrition and things like that, traveling can be really expensive, just in general, and especially for students who want to get involved, but they can't, say, afford to travel, or they don't have enough time to take out for traveling. What advice or resources would you recommend for those students who can't necessarily take out that time yet to get involved in global nutrition?
Okay. Well, number one, the global member interest group that has these mini grants and it will, once COVID lifts and the academy allows us, we'll be able to give it directly for travel. Get involved in a project that you can do here in the US. And one way to do that is if you live somewhere that you can volunteer for, like, well, I'm from Oregon. And so Mercy Corps has their headquarters is in Portland, Oregon. Medical Teams International, the headquarters is in Portland. There's another one in Seattle area, but go and try to volunteer for one of these organizations here in the States. some of them will even let you do it remotely. They'll give you something you can do remotely and get involved that way. A friend of mine got involved with Medical Teams International, just starting as a volunteer. And last I heard from her now, well, then she became a COVID clinic manager here in the US. And now I just last heard she's in Uganda managing something for them. So she just took these steps and now she's, international. So you have to start somewhere. And if you can't start by going because you can't afford to, you can't take the time off, but you have time in the evenings where you can work on a project as a volunteer, that's a great way to do it.
Awesome. And so our last question for you is, again, talking about global and international nutrition. A lot of students might be intimidated by trying to tackle something so huge, so vast as global nutrition. And so what advice would you have for students about kind of conceptualizing and kind of getting their hands into global nutrition? Because like what you said, you got to start somewhere. So do you have any advice for what you wish you knew prior to going into global nutrition, or just good mindset things to know when it comes to tackling something so big as international and global nutrition?
Okay, well, first of all, I would say that the landscape is totally different now from when I was a student 40 years ago. So, I'm kind of on the far end of the realm, but there are now about 6 or 7 internships that people could apply to if they're very interested in global health, global nutrition. They could apply to the Iowa State University and Oregon Health Sciences Center. Diane Stadler, who runs that program, she's very interested in international nutrition. They have a affiliation with some hospitals in Laos that they're working on. And there's, like I say, there's 6 or 7 of them, and I can't remember them all now, but they're listed on our website. So if you want to go to an internship where you will get some international experience, if you're interested, you could look those up. Also, you can always go get, Johns Hopkins has good international Master of Public Health. University of Washington has that. There's just a number of them. I think Alabama. So you can, Tufts University, there's many of them that have a Master of Public Health. Mine was from London School of Hygiene and Tropical Medicine, and you can apply for something like that and do that by online with international, so that you get a background. There are humanitarian master's degrees that you can get: humanitarian health, humanitarian management, emergencies management master's degree. So that's a good place to start, because you'll get connected. You'll have lots of connections then.
Yeah, and that's a great thing to note too, and especially with the 2024 changes in needing a master's degree, kind of honing in on your master's degree being circled around international and global, public, all that jazz. Really good thing to focus on. And so thank you so much for being here with us today, talking about your experience as a dietitian, all the awesome places that you went to help so many different populations. And so you were just a wealth of knowledge, and thank you so much for being here with us today.
Thanks for having me. If I can help another dietitian go into global, have a interest in global nutrition, that's worth it. So